Before we watch how the resident fared, let's review how to properly perform this critical procedure. First, if you have the time and the access, fully gown up and drape your patient. Depending on where you are practicing, you might have to alter your setup, but perform this procedure as sterilely as your conditions allow. If your patient is awake, use sedation. This is not a procedure where you want them moving. Here's your patient and here's his heart, and you want to access it without going through the lungs. In residency, I was trained to do this by taking a large bore needle with a syringe attached, inserting it through the subxiphoid space, aiming at the heart and stopping when I got flash. This is a fine way to do it if you're going in blind, but you do risk going through the medial aspect of the liver, and you do have a window through the chest wall with an unobstructed path to the heart. This parasternal approach is what we've been doing at HUM here in Haiti. And we do it using a regular 16-gauge IV, a 3-way stopcock, and a 60cc syringe. But you can use whatever large bore needle, catheter, or drain you want. But do remember that with ultrasounds, flash is not the all-important thing. What is important is that you are watching your needle tip at all times. You should always know where it is. You're looking for the largest pocket to tap. Make sure you find your lung point so you know exactly where the left lung is and stay away from it. Remind yourself that the left internal mammary artery runs just lateral to the sternum, and take a second to look at your screen and see if you see anything pulsatile. If you do, stay away from that too. And remember, whenever you go through the chest wall, you want to stay away from the inferior aspects of the ribs to avoid the vasculature. Now get ready, you are almost golden. But before you insert your needle, tell yourself the golden rule. I will not move the needle if I do not see the tip. Then insert your needle slowly and watch as it enters on the right side of your screen. Again, if at any time you lose the tip of the needle, stop, find it, and then continue. Once you see your needle tip inside the pericardium, you can slowly withdraw the needle and advance the catheter. At this point, you should have no doubt where the catheter is placed. Now, let's get back to our resident. Okay. Going very slowly. Very slowly, I'm going to find your tip. So don't go. Oh, there's your tip. You see your tip?
Where?
There you go. So going very slowly. Find your tip better. So, find your tip. Okay, you're very close. A tiny bit in. Okay, you're in. You're in. You're in. Thread. Leave it. Good. Good. Very good. That was really good. All right.